Thank you, Mr. Speaker Pro Tem. So the good news is we have only till 10. The bad news is I'm going to use every second of it. All right, let's race through this because originally I think I was going to go almost an hour. So maybe this is mercy. I want to walk through just a couple concepts here. One, we're going to talk about one of my intense frustrations. And I've talked about this for a decade or more. Please, how do I get my brothers and sisters on the left, those of us on the right, to understand we've turned healthcare, the whole discussion of healthcare, we've turned into financial engineering. So work with me on this. ACA, many of you know it as Obamacare, is a financing bill. That had community rating in it, so, sort of the guaranteed access, but it's a financing bill. It's who gets subsidized and who has to pay. Our Republican alternative was a financing bill. It just had a little better actuarial modeling in it. Medicare for All is a financing bill. We don't have the discussion about what we pay. The waste, the fraud, the adoption of technology, the adoption of cures, the adoption of how we deliver, the adoption of making you autonomous because you can wear your medical lab on your body now. As I wear one of the data rings. I experimented with a Dexcom in the last couple of weeks. Those things. Instead, we're going to beat up each other around here. The Democrats are going to try to make a political issue out of it, and we're going to basically fumble because we have trouble explaining. You've turned healthcare into financing. They want to hand out billions and billions and billions and billions of dollars more to insurance companies to buy down rates. So let's actually walk through some points I want to make. First one. Now, I desperately hope this number evens out as we go through the rest of the year. But our model right now says in the first quarter of this fiscal year, remember October 1st, we begin the 2026 fiscal year, for every dollar we're taking in tax collections, Mr. Speaker, we're spending $1.62. Now, our original model was every dollar in, we'd be spending $1.43, $1.42. But our spending is up, and what's this driving that spending being up? It's the refinancing of our debt at higher interest rates, because we had all that debt we sold a few years ago at very low interest rates. And the fact of the matter is, healthcare costs keep going up. And the stupid discussion we're going to have here is a financing debate. How much more subsidies should we hand out? And not a discussion what we're going to do to change the price of healthcare. So let's actually take a quick run through this. I'm going to try to explain a couple basic things about the ACA. Most of you know it as Obamacare. And look, this chart's hard to read, from a distance, but ACA goes into effect. I want you to step all the way back out to where we are here. When the enhanced premiums, enhanced subsidies, these are subsidies on top of subsidies, is $40 billion. Over here, the basic subsidies, the growth of the subsidies since the pandemic, another $75 billion. On top of the base subsidies that are $80 billion. And this is only 7% of the healthcare market. So let's take a look at that. This is so hard for people to understand. And I was listening to one of my Democrat colleagues speak the other day, and it was a complete distortion field of the truth of what's going on out there. It's all the healthcare is going to go up this much. Are they willing to admit they screwed up, they created an absolutely distorted model, and they put up, by screwing up all the incentives, everyone's healthcare costs went up, even though the ACA, Obamacare, is only this little wedge here. It's 7% of the healthcare population. The vast majority of the other population gets it through their employer, veterans, Medicare, Medicaid. But then I need you to see this other little wedge there. That's the portion that's not getting subsidies from you as a taxpayer. The rest of this red here is getting subsidized. I'm going to show you a chart in a moment where 41% of this population that's being subsidized in the ACA had no premium at all. You as a taxpayer bought their health care. Is that really what the Democrats promised us? Does anyone remember President Obama? We're going to lower your health care premiums by $2,500. You're going to get to keep your doctor. Should we hold the left to their own standards? We as conservatives need to get off our hiney and start explaining that if we continue this model, we're all screwed. We need to step up and say, we can do this better. We have technology. I've been coming behind this microphone for a decade. I'm going to try to go fast enough to touch on it where we can lower premiums rather dramatically. So let's once again I did this board the other day. I just need to show you, this is what they call an economic scoring of the enhanced premium tax credits, which is basically the subsidies on top of the subsidies. Functionally, only 38% of that $40 billion is actually going to cover actual insurance where people are going to use it. The vast majority of it is just disappears. It either doesn't get used, it may have disappeared in the brokers or the insurance companies, but something is horribly wrong in this money. And yet, when we actually start to look at these studies and articles, here's the GAO report about the ACA. It has a simple line here. Patient Protection and Affordable Care Act primarily results from ongoing review suggests fraud risks, particularly in the advanced premium credits. And then you read it, and it's page after page after the page of different types of fraud. People have been signed up and had no idea. Brokers who are going to prison right now because they've been signing up folks in the system. Obamacare is the mecca of fraud. Wall Street Journal from just a couple days ago. Open enrollment is a healthcare's most expensive lie. How many more studies do we need to explain? You're being defrauded. If this were helping people be healthier, bless it. But instead, because the Democrats are terrified to tell the truth that the model they built is only 7% of the population, almost half of that population is getting the health care for free, and it's created a distortion field of cost. And I'll give you a simple test. Ask yourself, go back 10, 15 years ago. Let's go do 10 years ago. The ACA goes into effect. How much have your health care costs, your insurance costs, changed? Remember, insurance is different than health care, but how much have your costs changed? Did they meet the promise that was given to you? We're going to make things more affordable. It's not the Affordable Care Act. And that's the reality of the math. So let's continue to walk through parts of this. The number of subsidized zero claims. This is fascinating. So the enhanced subsidies that came out after COVID, that were only supposed to be for 5 years, and the Democrats voted for this. I don't think a single Republican did. It was their plan. This was Democrat policy. And now they're acting all uppity, saying, well, you Republicans need to fix our mistake. Almost 11 million that were part of that enhanced population never made a claim. We're now seeing studies, data mining, looking at a huge portion of these people had no idea they'd been signed up. It was rampant fraud. So let's have a little more fun here. How many were enrolled with these enhanced subsidies, ended up having no skin in the game at all, had no cost? Last year, 41% had no cost. You as a taxpayer paid for their health care. This year we modeled that it's going to be around 39%. But think about that. Is that what you were promised? Is that what you were told? And we start to walk through this. 6.4 million people this year were improperly enrolled in subsidized Obamacare plans costing taxpayers $27 billion a year. Understand what this means. It's rampant fraud. How many members of the Democrat Party, the left, have you seen come behind the microphone and say, hey, we really like subsidized health care, and we really like the level of fraud, so we don't want to change anything? %96 of all applications representing fake enrollees were approved on the Obamacare marketplace and received subsidies. Understand, remember we were promised, well, the website is going to find fraud. Turns out 96% of the fraudulent applications going in, where someone's just bleeding the system, they're getting approved. The system doesn't stop the fraud. This is your money. You're paying for fraudsters. You're paying for brokers that are going to jail. You're paying for, does anyone understand? And our debate here is, well, we want to give another $40 billion to the fraudsters, but there'll be a portion of that that will get some buy down on their health care costs. In 2023, one Social Security number, and I use this one just because it's so easy to understand. Now remember, there's a system that's supposed to be mining this for fraud. One Social Security number was used and got 125 policies. How do you not catch that? We're really that bad at this. Yeah, I'm not going to make you go through that. Look, this chart is almost impossible to read. I'm going to put it up on my website. But what you need to understand is this is the different ways people end up in healthcare.gov, healthcare.care, the broker community, those, and walks you through how much what we're discovering has no actual checks for fraud. Have the Democrats stepped up and said, okay, we know a huge portion of this cash we were handing out after COVID has been disappearing. It's not going to make our brothers and sisters healthier, provide them access to care. But they're willing, no, they're not willing to actually fix this system so we're not bleeding American taxpayers. Now let's actually talk about some solutions. But first, I need you to understand how perverse the system is. I've come behind the mic over and over and over and over and over and said, you have this technology that you can wear, this thing you can blow into, this thing here that can diagnose, this thing is actually this wearable here is more accurate than a human doctor. The Apple Watch now is an FDA-approved medical device for the heart. Should it be allowed to prescribe? But I need you to understand how perverse healthcare has become money-wise. And this one is absurd, but it's easy to understand. Here's a couple articles. Paper industry, drug makers spar over requirement to print prescription forms. To show you how absurd the world has become, there was a simple attempt to say, we're just going to put your prescriptions on your phone. So when you get them, you can see all the side effects. You know all that paper that's printed? And we had lobbyists here and a U.S. senator who blocked it, saying, no, my paper industry. When the paper industry was able to stop a simple money-saving reform, because apparently cutting down trees and turning it into paper pulp and printing it is more important than something that would have been dramatically more efficient. It's gotten that absurd. Our attempt to basically run a piece of legislation, because we did a study on how many duplicative MRIs, X-rays, ultrasounds, CTs there are, we have some numbers that look like it could be as much as 25 to 35 billion a year. So do something crazy. When you get your knee MRI'd, put the data on, the images on this, and so when you go to your next doctor a week later, it's right there. Doctor, let me hand it to you. Not get another scan. And we already have lobbyists running around the building saying, no, the duplicative scans are part of our profit model. where are my own brothers and sisters, particularly on the conservative side, saying, we want to unleash technology. We want to unleash doing this a better, faster, cheaper way. For those of you who run around saying, well, PBM reform, fine. But understand, every study we have right now is PBM reform saves a fraction of money, and it's already happening. When you start to see companies now ditching the middleman and starting to sell directly, when you're now starting to see, go look up Civica RX for anyone that's in front of a computer, when it's a co-op making drugs, selling insulin cheaper than the government, our federal government subsidized price. The fact of the matter is legalizing, encouraging, incentivizing disruption in the market where you get all sorts of different channels. So if the PBM is the best price, God bless them. If the drug company wants to sell directly to the consumer, bless them. If a co-op wants to get together with your Medicaid system, a hospital system, an insurance company, and they decide, we're going to manufacture our own, and we're going to do it cheaper than the government subsidized price, bless them. There are ways to crash the price of healthcare. We have one right here. It's a discussion of AI. And AI went through someone's medical bills and started realizing how much misbilling there was in there. What if we did something very, very simple? Legalize one of my AI billing, we call it clean claims, where here's the doctor's notes, here's the insurance contract, they meet, it gets paid. How much staffing and other things would you save, but also how much more money? That we have the technology, I just can't seem to get our brothers and sisters here willing to accept the bills. Here's another one that's incredibly optimistic. If you have a subscription to Wired magazine this week, and it's something we in our office have been working on for years now. They call it a fentanyl vaccine. It's not technically a vaccine. It's a protein binder that attaches to the drug, making it so it can't pass the brain-blood barrier. It's an entire article in Wired magazine. We did some research. I had trouble believing this number. I had one of my economists actually go back and double-check it. 1.5 trillion in 2020 is cost from fentanyl. There are solutions, Mr. Speaker. We need to step up and start understanding there's a moral way to approach the cost of health care. And it's not a bunch more taxpayer subsidies. It's actually lowering the price. And with that, I yield back.